Most families I talk to assume that keeping a parent at home with a caregiver is the expensive option, that assisted living is the practical, realistic choice, and that home care is some sort of luxury for people who can afford to do things the nice way. I want to show you why that's almost always backwards, and why the real financial risk isn't the cost of home care. It's the cost of not having it. My name is Chrysler. I'm the owner of Right at Home Long Beach, and I work with families across Long Beach and the gateway cities, Lakewood, Downey, Signal Hill, and Bellflower, and other surrounding areas to figure out what care looks like, what it costs, and when to start. I got into this after being a caregiver myself for a family member who needed more help than I knew how to give at the time. And I've spent the years since learning how to give families the honest picture that I wish someone had given me about home care. So let's get into it. Here's the number that surprises most families. Assisted living in Los Angeles County, a standard private room in LA County, standard care level, typically runs between $4,500 to $7,500 a month. At the midpoint, that's about $6,000. Home care at 20 to 25 hours a week, which covers most mild to moderate needs, runs roughly $2,800 to $3,700 a month in this area. So at moderate hours, home care is less expensive than assisted living, often really significantly less. Now, at higher hours, 50, 60 hours a week, home care gets expensive. I'll be real about that and straight about that. At that level, sometimes spending as much as residential facility. And now you have to weigh whether at-home setting is worth the cost difference. But here's the thing. Most people who think of home care think of the high-hour version. They're thinking full-time, round-the-clock care. Now, that's one version of home care, of course. But the more common version, the version that has the most financial leverage, is the earlier version, 20, 25 hours a week, before the needs escalate. And that's often where the real value is in home care. Actually, let me back up for a second because I want to be honest about something before I go even further. I'm not trying to convince you that home care is always the right answer. For some families, it isn't. For some levels of need, a residential setting genuinely makes better sense. Now, what I'm trying to show you, though, is that the assumption most families walk in with home care is the expensive option isn't accurate. And that assumption is really causing a lot of families to delay, and that delay is costing them. So let's talk about what the delay actually costs. Delaying in getting home care. The Center for Disease Control and Prevention reports 36 million falls among older adults in the United States every year. 3 million end up in emergency department. 300,000 result in a hip fracture. Now, I want to focus on that last number because hip fractures are where the financial picture gets serious fast. When a senior fractures a hip, here's what happens financially. Hospital admission, surgical repair, that's $25,000 to $40,000 in California. Now, Medicare covers the bulk of it, but there's a deductible, and there's cost sharing after day 60. Then inpatient rehab, usually a skilled nursing facility for several weeks. Medicare covers the first 20 days fully. Days 21 through 100 come with a significant delay, daily copay, and after day 100, Medicare stops paying. Skilled nursing facilities in LA County can run $9,000 to $14,000 a month out of pocket. Now, then there's a discharge, the question nobody planned for. The patient goes home or to assisted living, and they need more help than they did before the fall. All in on all this, the first year cost of a serious fall is commonly $40,000 to $80,000, sometimes even more. And here's the part that's hardest to look at. About half of older adults who fracture a hip they don't return to their prior level of independence. For many families, that fall is the event that ends independent living. Now, a caregiver doesn't prevent all falls. I want to be honest about that, of course. Falls happen. But a caregiver who assists with bathing, who's present during high-risk morning transitions, who notices the side effects of blood pressure medication that causes dizziness, that caregiver meaningfully reduces the probability of the event, of that fall. And a $40,000 prevented event is worth lots of months of home care. This one surprises families even more than the fall statistics that I just shared. The New England Healthcare Institute estimates that medication non-adherence, not taking medications as prescribed, cost the U.S. healthcare system roughly $300 billion annually, almost entirely from preventable hospitalizations. In older adults, that adherence problem is complicated, right? A lot of my clients are managing 5, 6, 7 medications at once. Some of those side effects that make you feel worse when you take them. Cognitive changes can make it hard to track a complex schedule. And when you're living alone, nobody's checking your meds, a missed dose for a day turns into a pattern. Now, our caregivers aren't nurses. I'm not going to overstate what they do. But they're there every day. They do the pill organizer check-ins. They notice when something's off. They call the family. They call our agency. And that daily presence is the difference in a lot of cases between a doctor's appointment and an ER visit. So let me put this together for you because I think it's the clearest when you hold both pieces at once. Now you've got the fall risk and you've got the medication risk. Both of them are partially controllable. Neither of them shows up in most families' conversations about care. They focus on the care, not the financial risk underneath the care decision. When you add those two pieces to the cost comparison we looked at earlier, home care stops looking like a care cost and starts, quite frankly, looking like a risk mitigation or management strategy. And that's the frame I offer you. It's a risk management strategy. Here's the part I wish I could sit with every family for an extra 5 minutes on. The home care value argument is the strongest in a specific window, usually 1 to 3 years before a care transition would otherwise happen. The mild to moderate need period, when the senior is still relatively independent but has some gaps, needs some assistance in bathing, medications, meals, some help in mobility. Now, in that window, the hours needed are a lot lower, so the cost is lower. The risk of a catastrophic event is real, but still influenceable. The caregiver's presence is a genuine change to the trajectory, not just support in an already determined situation. Once needs escalate significantly, advanced dementia, full-time medical supervision support, you're past that window. The trajectory is more fixed. And the institutional alternative becomes harder to avoid. It's harder to stay home. The best time to think about home care is not after a crisis. It's during that window. And the families who plan ahead, who start earlier than they think they need to, almost uniformly tell me, oh, I'm so glad I did it. Not just financially, but emotionally, anxiety-wise. If you're working through this for a parent or a family member in Long Beach, Lakewood, Downey, or any of the surrounding communities, we do care consultations where we walk through the whole picture with you. The care, the timing, the costs, what makes sense for your specific situation, the pros and cons, and the trade-offs you may be making. We're at careinlongbeach.com, or you can call us at 562-786-6773. Now, if this helped clarify the picture a little bit for you, I'd appreciate it, as always, if you subscribe, like, or share it with someone who's in the middle of these decisions. These are conversations I think more families deserve to have before they're in crisis mode. And if I can be useful to your family, I'm here. Thanks for watching.